So I know that I promised I would talk about the hospital stay next. I do want to talk about that, but first I want to focus on just one aspect of that really just made an impression upon me. So I arrived at the hospital and checked myself in Monday morning, and sometime during the day this lady showed up. This is basically just what I gathered from the situation. Was she has diabetes, she was at dialysis, which I guess means she also has some sort of a liver problem, and she lost a lot of blood there. I'm not sure how you would lose blood at dialysis. So somehow she arrived where I was unexpectedly, but at the same time I think she was planning on being there anyways, just maybe a bit later, because she has some exam that she does every year that requires her to take iodine, and she said that she's allergic to the preservatives in the iodine, which she knows because in any other context she has no issue with iodine. But every year when she does this exam and she takes the iodine, about a day and a half later she'll pass out, which is why she wanted to be hospitalized this time. And so they gave her the contrast or whatever, and she seemed very much out of it. Like, you know, you could tell she was having a rough time. And later on in the evening, while she was sleeping, she was making this sort of like weird whistling, gurgling noise, and I thought, okay, this is someone who just has a strange snore. And then the phone started ringing, and it stopped ringing, and then a little while later there would be another phone call. And I kind of felt like, you know, this is someone who wants to check up on her. The phone's ringing really loudly and she doesn't hear it. Maybe I should like answer the phone and just to let them know she's okay, right? For some reason I had this feeling like I should call the nurse. But I mean, at the same time, like, she was clearly still breathing, you know, so I didn't say anything. And then eventually the person who had been trying to call her called the nurse's station, and the nurse came in to wake her up and really just started like slapping her, like really slapping her, like with force, to get her to wake up, and, you know, speaking very loudly, and basically what they determined was that she had forgotten to take her insulin and had fallen into a glycemic coma. So then of course I'm thinking, okay, I guess maybe I should have alerted the nurses a bit sooner, but at the same time, you know, why didn't they come and check on her? Why didn't she have a heart monitor? You know, they did give her some meds to bring her temperature down. She had a fever, and the insulin and everything, another IV, so, you know, things started to stabilize. She was still clearly suffering, and, you know, I felt so bad for her. Like, you know, every time somebody would ask her a question, you know, are you okay? Are we gonna do this? Are we gonna do that? She would just go like, yes, yes. And, you know, someone like kind of jokingly called her, yeah, it's Miss Yes or something. You know, they said, so are you all right? And she goes, yes. And they go, oh, this one nurse was so sweet. She goes, no, you're not all right, but it's okay. We're gonna take care of you, and, you know. So once she was out of the coma, things calmed down and they left the room. She was a bit more conscious, and she would just say to me, she would, like really the only time we spoke was she would say, please. And I would say, oh, do you want me to call the nurse? And she said yes, and I would press the button for her. And that happened several times, and that was really like the only exchange we had. And then at one point, the next day, or the next evening, I hear this like thump, and I realized she got up to go to the bathroom and she fell. And in that moment, of course, I'm like, okay, yeah, I'm gonna call the nurse. And I got up to try and help her, and I'm like trying to see like, okay, how do I help her get up without, like I want to make sure the stand with the IV on it isn't too far away and doesn't pull on her, but how do I pull her up? And she seems kind of like more embarrassed and was trying to like, pull her nightgown down to cover, like, probably more so than she would have been with a nurse. Trying to get the nurse in the room, and I realized the door was blocked, so they couldn't get in. It's like, so what would they have done if she'd been in the room by herself? And I got her up to her knees, and the nurse was on the other side of the door, like, watch out so you don't, catch your fingers. She put her fingers around between the door and the frame, and like I wasn't paying attention to that, and I feel like just very strange for me as a bystander in that situation, where I felt like I probably should have called the nurses even sooner the first night, and then when they were there helping her, I felt like it's weird to just sit there in the next bed and do nothing. I feel like like I don't want to stare at her, but I also don't want to just do my own thing like nothing's going on. When they have a question, I feel like, oh, I'm right here, I hear everything. If she doesn't remember something, I should be able to like remember for her and fill them in. And then at the same time, when there's like something urgent like that, it's like I really don't know what to do in that situation. And it makes me feel really helpless. Like, I wish I had some sort of like emergency medical response training, or something, so that I would know how to react, like what to do. But yeah, then you're in this strange place where it's like you're not obligated to do anything, but like morally, I don't know, is it like, do you have a clear conscience if you don't? But of course you shouldn't, because you're not an expert, and the experts are right there, where it would be different on the street with no one around. I don't know, that just it really got to me. I figured if you're watching this, then you probably have spent some time in the hospital yourself and maybe encountered a similar situation. So I thought I would just put this out there and see what everyone else's experience was. Like, how do you feel in that situation? Yeah, so I don't know, that was on my mind, and I wanted to talk about that first. And next week I will cover my own situation in the hospital.